Nothing prepared me and our teams in our community for the stress that we've all been facing over the last 20 months. And for me, it's the worry about the children and the families.
3/4 of all psychiatric illness that we see in adults is already present in people by the time they're 21 years old. One of the things that TM does is it helps decrease excessive autonomic arousal, which is critical in the stress response. So when you teach somebody how to meditate, they've developed a technique for managing stress.
There have been numerous studies documenting the benefit of TM in children and adolescents. This first clinical trial suggests significant effects of TM on the emotional symptom scale, which captures things like anxiety, anger, and fear, and significant improvement in quality of sleep. TM was associated with significant decreases in negative school-related behaviors, including school infractions, absenteeism, and days suspended from school. In sum, these studies suggest that TM results in significant clinical improvement in children for a wide range of mental health issues, and that TM is associated with clear evidence of changes in brain activity and increased coherence of nerve cell signaling across brain regions.
In the US alone, over 20% of adolescents report symptoms of insomnia, with even higher rates seen in vulnerable groups such as adolescents with depression, anxiety, or ADHD. While we know that adequate sleep helps regulate hormonal and physical functions, often we forget that it is also critical for cognitive and behavioral development, including emotional regulation. Scientific data now shows that transcendental meditation helps to reduce insomnia, especially in vulnerable groups. A recent scientific study is about to be published showing that transcendental meditation was an effective intervention to improve wellness and sleep quality, also in high school students, while reducing their levels of stress and anxiety.
Urban high schoolers practicing TM twice a day during quiet time, compared to a similar group of controls, had significantly decreased anxiety and increased resilience in a high-performing high school where internalized pressures and stress were leading to increased anxiety, school refusal, and suicidal ideation. There were significant reductions in the TM group versus controls in perceived stress, anxiety, anger, and depression scales. Comparing American university students who learned TM to controls showed impressive results, significant reductions in total psychological distress, anxiety, depression, anger, hostility, and improved coping ability versus controls.
I think a lot of times when you prescribe treatments, at least in my world in child psychiatry, you're asking people to be very patient. It could take weeks, months even to see real effects. I guess one of the most remarkable things for me is when I prescribe TM and somebody comes back to me and they say, it's really working. It could be a matter of days.